everyone, we're your hosts, Chelsea
and Robin.
And this is Don't Mind If We Do.
Finally, a relatable podcast for women where we can talk about whatever we want.
Don't mind if we do.
I'm gonna wanna get crazy. Anything but behaving like you do. Make you. Oh, don't mind if we do.
Everyone take a deep breath.
Everyone settle it down. Chelsea will sniff a few times. So
That's just what this room makes me do.
Nailed it.
Good.
Nailed it. Okay.
Good.
All right.
Okay. We are.
Kent, you're good?
Is this
Okay,
episode
good.
32 for real, though?
Yeah. Isn't that amazing? Yeah.
Okay. I thought we were on like 20.
Number 32.
Yeah.
Congrats,
We're
guys.
pretty good. Yeah. We're not bad. We've got, like, what are we at? 75? About 7,500?
Download, yeah.
Yeah.
A million, almost at a million.
Yeah.
So,
Did you count number 13?
Right? Lucky number 13.
You're not supposed to.
I know. We should go back and figure out why that
So we're
episode.
just
Is that when it
under
started to go downhill?
Is that-
Probably. Yeah.
Is that guest still alive? You might want
Maybe
to
you
check
should
that.
have a podcast. I feel like maybe Dr. Ken Banks.
Murder
right?
Mysteries of
Right?
number 13.
And you would know all the body parts. So I would feel
true.
okay about listening to that. Okay?
Yeah.
Just think
True.
about it. Don't say no right away.
Or more creepy because he knows about it.
right?
Right.
That's true.
Like the metacarpal
I have to go.
gone.
Trust me.
I have to go. I'll see you guys
Trust
later.
me, I'm safe.
Yeah.
You guys,
Trust me.
I might sound
Famous last
creepy
words.
on a podcast, but I am safe.
Yeah, well, just look at his photo. You'll know.
Says every serial killer.
Right?
Trust
Absolutely.
me,
That's
I'm
totally
safe.
something a serial killer would say. I agree.
I think it's time for me to go home.
Dexter. It's part one of Dexter here.
Actually, I know where you live,
Oh,
Chelsea.
shoot, I am home. Let's drink. What are we drinking today? Today,
okay, what are we having?
due to the topic of our podcast, we are having Millionaires Row because we're a bunch of millionaires in this room.
Are we?
Not?
In spirit,
Yeah,
maybe.
like in personality.
Oh, right.
We have
Yeah.
millionaire personality.
Yes, that's,
Yeah.
yeah. Thanks for describing me that way.
You're welcome. Okay, I have $1 million, but that's fine.
Do you? Okay, can I borrow some?
So close.
Can I have some?
Kent Banks and I would like to have some money.
Ken's
Thanks.
looking at my
Yeah.
forehead. If you have $1 million, why
Right?
is it wrinkly?
Pay it up, sister.
She's
Okay?
lying.
You're too busy making the big dineros.
Gosh,
That's true. So this is from Summerland.
Thank you.
I love it. I love the smell of it. Yeah, here's the thing. Just so you know, I always sniff all drinks that we try in the podcast just to see if there's like if I can preempt what it's going to taste like.
And I just sniff because my nose is running.
Yeah, that's
So
totally different.
We're twins.
Happy New Year. Happy New You.
Cheers.
Happy
Cheers.
New Year, guys.
Cheers. Dr. Kent Banks from MD Aesthetics, thanks for being here today.
Thanks for having me.
And
So exciting.
yeah, we're super excited.
Wow.
We're excited to be refreshed and rejuvenated this year and to be better versions of ourselves, which we, are always striving to do.
Almost
Not that there was
impossible,
anything
but,
wrong
yeah.
with how we were before,
There's
right?
nothing
Like,
wrong
let's
with
just be
it.
clear. But,
No,
but
we're all beautiful on the inside, and it'd be nice to kind of put the last couple years behind us and kind of move into 2022.
Yeah.
right?
Looking and feeling our best. How does
Yeah,
that sound?
that's
right.
perfect. You should actually
Yeah.
just do this podcast. We don't even need to be here.
And on a side note, did you bring any Botox syringes to fix my forehead while we're sitting here? Like,
Just putting you on the spot.
That
just-
was an
yeah.
epic fail. My
Shoot.
apologies.
I should have asked ahead of time. That was my bad. My bad.
Well, it's too late.
you
Now he's
both-
been drinking too, so you don't want that. You don't
I'm
want
okay with
under
that.
the
I don't
influence.
care. I think he's that good that it wouldn't matter.
That's true.
Yeah.
Yeah.
I
No,
agree.
I've joked I could probably do it in the dark if I needed to. Yeah.
Right?
We've actually had some power outages, and we've had to,
do it
kind of,
anyways.
we're mid-treatment, and we actually have to get the flashlights out and the cell phone light, the light from our cell
It's like
phones
in
out.
ye olden
Botox is
times.
important.
Right? It is.
Yeah.
And that's the thing.
Well,
you can't just stop.
You can't leave somebody half done.
No.
Because that looks really quite...
Looks
No.
bad.
Yeah,
People are like,
quite
I don't know what happened.
Maybe they got a little extra in the power outage, which is a
Right.
benefit, maybe.
It's
Yeah.
worth it.
Got a couple extra. Not that it sounds like that when it
That's
goes
true.
in.
I
But
was going to say, I don't think that's what it sounds like. If
Well,
you had
I haven't seen those patients back again, so I don't know how that turned out.
they might have died, but just like our guests on our podcast.
right?
So,
it's a win-win
a
here.
lot of death talk today. I don't like it.
Dr. Banks, as a doctor, at what point in your career are you like, you know what, I'm gonna do like 1,000,000 years of school, and then I'm gonna be a family doctor, and then you know what? No, I'm gonna leave that and go and just pursue well, I don't want to call it a career in nip tuck because I'm pretty sure that show is not really accurate in anything. But you know what I mean? In actually enhancing people's looks and wanting to help them make themselves look and feel their best.
Well, I think the probably the two biggest things for me were the first thing was I was always interested in procedural medicine. So kind of doing things practically and being able to see the results right away and kind of getting that kind of instant gratification for myself, but also for the patient.
Right.
So that was one thing. And then the other thing was just, with what we do at NB Aesthetics, it's more about, making the person look good, but it's more about how it makes them feel on the inside. So it's kind of changing their confidence levels and making them feel just kind of better.
It's true.
Better about themselves.
I feel like shit right now. Because
I
my
don't
forehead
know why. You
is
look
wrinkly.
great.
She looks great. Doesn't she look good?
She does look really good.
I don't fully feel like shit. I just, I have a wrinkly forehead, and that's because I haven't come back to see you. So it's
Whose
my
fault is that? Kind of
It's
your
mine.
fault.
Well, it's kind of my fault because I didn't bring Botox for
That's
industry.
true. So it's both of our faults. We'll both take the blame. But it's true. When I have I'm almost 40. There's nothing wrong with wrinkles, but when I have a smooth forehead, I like it.
You feel better about you.
And I like my lip filler, and I will never stop getting it.
I think both of those things are really common, like, and Botox, people think of it as a corrective procedure, but there's a lot of prevention that goes into Botox.
Even at this age?
Absolutely.
So your
I
age
wouldn't
is
say
not even. I know. I was just going to say I don't feel you're that old.
Well, I was told to get it in your 20s because then it prevents it.
Ah.
But I'm almost in the doubles of the 20s, so
I like your math.
thanks.
Should you get it done young though? Like, is that something that you can? I mean, I guess that
that
there's
a
certain
thing?
situations, right? Like that's.
Yeah, I think to be proactive, and there's a term prejuvenation that's out there right now, but it's basically about prevention. And for people that come in, say in their mid 20s, I think 25 would be a reasonable time to at least start to do something like Botox, because at that age, it's going to prevent those kind of what we call static lines from forming, the lines that are present when you're not frowning or
Right.
making a facial expression.
I'm always frowning, apparently.
That's what we've learned mostly.
I'm always so mad.
so mad.
Yeah, and I always find that people who do start earlier, they always look better as they age
Over time, right?
Over time.
Because it's like I know you've said this to me before. It's accumulative, so you can go and have a treatment, and then maybe you'll have to have a few every few months, but then over time that time would space out, right, as to when you would need your next treatments.
That's right. Yeah. So for people who start a little bit, when they're a little bit younger in that kind of preventative realm, we tend to not have to do it as frequently, and we tend not to have to do as much.
Yeah, that makes sense.
Yeah.
What else in that 20s realm? Like, say, if we're talking about different age brackets, and for us as women, but also for men too, right? I mean, this is for everyone. So are there certain things that we should think about, say, in our 20s versus in our 30s versus in our 40s or plus when we're thinking about skincare and really taking care of ourselves?
Yeah, absolutely. So in our 20s, I like to, again, look at the preventative skincare. And so people in their 20s, we're usually talking about, getting, very consistent with using sunscreen, looking at their skin type, addressing dryness of the skin if, a moisturizer, a good hydrator, maybe getting them started on a retinol early because, in my estimation, a retinol, there's really not a better ingredient for anti-aging.
This is the Benjamin Button serum of anti-aging. Is that correct? This will actually this will really help anti-aging.
Reverse time.
What does it do? How does it work?
So a retinol, basically just kind of normalizes and facilitates cell production, but also collagen production. So people think of retinol as just being a really good exfoliator. It does that, it kind of exfoliates the skin, but it also kind of stimulates those healthy new skin cells to form. And over time, our skin cells become a bit lazy, so they kind of slow down in their production. They stop producing as much collagen, whereas the retinol helps to reverse that aging process.
Okay, so
Does alcohol help with that? Does that help with the aging process go faster?
yeah, I think you're onto something there. Yeah.
'Cause Robin's skin looks very young.
She's well preserved. Alcohol is a good preservative.
No,
I'll give her that.
She's not preserving. That's why.
I'm the opposite.
Yes. Like
so
hers looks young. Because she doesn't drink, right? Like it doesn't.
Everything
benefit your
in
skin.
moderation, I would say.
there it is. Yeah.
Delicious alcohol, right?
I think the general thought when it comes to kind of alcohol or any nutrition with the skin is basically what's good for our body is going to be what's good for our skin.
Alcohol is good for the liver.
Certainly makes it bigger
I don't
initially.
know. I'm not sure if Chelsea went to medical school. I don't.
I did. It's a different one than you went to, obviously.
What about when you get into your 30s? Say like your late 30-ish. I don't know. I don't want to bring up
Why are you
anyone.
looking at me like that?
Yeah, no reason.
I am late 30s, very late.
Yeah,
39.
late 30-ish.
So just about 40.
Yeah.
Jeez. Ugh.
So, in that kind of 30s to 40s realm is when we'll often start to do some reversing treatments. Some treatments that will.
Tell me more.
Yes. Well, Chelsea, you are doing great because a lot of those treatments are simple treatments like Botox, and sometimes we'll talk then about soft tissue filler.
What is that
That's my
for anybody
next
that hasn't had it done? How would you describe that to someone?
So we all lose structure over time. So we all lose, support underneath our skin and in our tissues, and so that shows up over time as sometimes shadows, sometimes loose skin in the lower face, and a lot of those changes is related to loss of structure, and it's actually loss of structural fat, so it's kind of good fat. So unfortunately over time we
lose
usually
the good fat.
So we lose the good fat,
Gain the bad fat.
kind of gain the bad fat.
Boo.
Lame. I don't like that. No.
The good news is, so a lot of people say, well, should I just lose weight and my body will look good, but then your face actually starts to lose even more.
Sallow.
So, yeah.
Like in some ways, and I've read this, I don't know if this is true, you could confirm as a doctor. But,
Are you talking to me? I'll confirm it.
Obviously.
Obviously.
I was talking to you.
Yeah. Good.
But
Thanks.
as you get older, it's actually a little bit better to keep a little bit of extra weight in your face just so it doesn't look as sunken. Is that a thing?
Yeah, and if people don't have to do that by, changing their body weight.
Right.
That's kind of where I come in and that's where soft tissue fillers come in because the soft tissue fillers that we have are composed of a natural substance.
Okay.
And most of them are composed of what's called hyaluronic acid, which is one of those kind of structural substances in all of our bodies. And so it is kind of a natural substance that we're using. And we basically restore just enough, like a good practitioner won't over augment or do a treatment that looks unnatural. So we really want to just kind of restore enough to kind of take those contours back to the way that they were, say, 5, 10, maybe even 15 years ago.
Yeah.
It's true. You don't overdo things.
No.
I've asked you to overdo, and you have said no.
Yeah.
Yeah, which
But-
is good.
Yeah,
But-
and there's a reason for that,
There's a
right? Like
reason,
you always
yeah.
say that you want us to look refreshed. Like we just got back from a vacation because nobody can go on a vacation anymore. You know what I mean? But it's like you just want them.
Yeah.
You want people to look natural, and I would say that is the biggest feedback that I have about my work. When people ask me, "Oh, your skin looks great at 47," like I would agree. I do not look 47, and that's because of Dr. Kent Banks, my skin wizard at MD Aesthetics. You know what I mean? But I would say that the work of a true genius is to make it look like there's been no
there
work
has
done
no
at all.
work, yeah.
Yeah.
It's very true.
Yeah, and that's always our goal. And the best treatments are the ones where your friends, your family, they notice that you're looking better, but they can't put their finger on it. They think,
Yes.
oh, you've got your hair done, or You know,
You look so
is that
rested.
new makeup or yeah, exactly.
So, Robin, can I ask what have you all had done
Yes.
at MD Aesthetics?
And correct me if I say anything wrong, Ken Banks, because you're in the room. So I had most of my face has Botox in it. I think that's fair to say at this point. I
Most?
have most of it. Yeah, I have it across the forehead.
Yeah.
The only place I don't have anything is my lips. My lips are the one thing that we've never had to touch or do
Wouldn't
anything
have
to.
and I always thought you had lip filler.
She's got
Your
great lips, yeah.
Amazing.
So that's the only thing that we haven't touched. But I would say other than that, like I definitely have it on my forehead, like around my eyes. I have filler in my cheeks
So
for
good.
sure. We've done a few things in the chin area, which I do believe makes a pretty big impact right away. What have we done there?
Yeah, so in your chin, we did a little filler initially,
Okay.
just to restore again a little bit of the structure, because that filler will often help to tighten and straighten the jawline as well.
What I need.
Yes.
Right in the chin. Right in the kisser. No,
I know,
chin.
that's different.
Chin.
Those are two different places. Okay, that's
Anyways,
fine.
carry on. I like to interrupt, so just carry on.
One of us just yells random things during the podcast. Okay,
It's
so
not Tourette's, it's ADHD.
It's the other doctor in the room.
That's right, yeah. My house, my rules.
Yeah, exactly. Right? Yeah, it's her studio. That's
Anyways, chin, good. Yeah.
Yep, nailed it.
The other thing that we've done with your chin, Robin, is we've done a little Botox actually.
Yes.
And Botox is, a lot of people don't even know that we can treat the chin with Botox. But the benefit of Botox in the chin is that, again, over time, our chin can often become recessed and it become a little dimpled. And that's often an over...
Yeah, you're doing it now. Chelsea's doing the right movement right now. It's when you kind of like suck in your lower lip, and then it kind of
It's
does
not an attractive look, though.
it does a dimple, right?
Good. So you can't do that?
See, when she's doing it, it looks very smooth.
And mine does not? Hate this day.
Silence.
I have to go.
So I need Botox in my chin. Well,
Yeah.
I don't think you've ever put it in my chin.
I don't think we've done
No.
your
I
chin.
don't-
So next time.
You
Yeah.
did around
We'll
the
look at
eyes,
that for sure.
and that was new, and I really liked that. Like, not close to the eyes, but around, and it was good.
Yeah.
And
We've
I think you did
also-
a little around the lips, too, one
Yeah.
time.
I would say to me though, and what I've noticed when I come to MD Aesthetics, the Botox, the filler, those things do what you know that they're going to do. What always amazes me is the effects of laser treatments. I find this mind-blowing. And it started, I think, when I first, I've been with you, Dr. Banks, now for 7 years.
Wow.
And right, so, and I think in that first year, and now if I look back on photos from that time, the amount of sun damage that I had on my skin versus what I do now is it's astonishing. Like when I look at photos and how much sun, because I was cycling a lot at the time, I did have a lot of sun exposure on my face, and I would never have noticed it or thought about it, except now when I look at photos versus 8 or 9 years ago versus today, there's zero. Like my skin, the clarity on my skin now is incredible, and that's because of a couple of different laser treatments that we've done, right?
That's right.
So we started with IPL, which is, and sorry, what does that stand for?
Intense pulse light.
Intense pulse light, and is that's a treatment that really it's fairly safe for most people.
Yeah, it is. It's a really it's a safe and effective treatment for most skin types. IPL is great because it not only works for redness of the skin. So we use IPL for people with rosacea, dilated blood vessels, little bumps of redness in the skin called angiomas. But we can also use it for treating sunspots. We can use it for treating pigmentation problems like melasma in the skin. And so it kind of works basically for giving really good skin clarity. So it's really good for kind of pigmented issues with the skin.
Yeah, and when I was in my early 40s, I had one of those done a year, and it made all the difference. And again, it's not you don't have to have it done often, but I found that mind blowing. Like I said, I knew or I had an idea what the Botox and the fillers would do, but the lasers are what really blows my mind. And then most recently, we've done a Fraxel treatment. So as I get closer to 50, I'm noticing a few things with my skin. And if you are around the same age, you will as well. And Chelsea's still young enough that I don't think she's getting this.
I'm
but
getting it. Whatever it is, I have it. It's there.
It's like a crepiness. I don't
have that
know.
fully all down my
I
neck
don't
and all
see
down
it.
here.
See, and what's this area
Yes,
called?
I
The
do.
décolleté or something? The
The décolleté.
yeah, décolleté. That's
Deco de mode is where you get your nails done.
décolleté. The décolleté is what's. But it was. I was noticing some crepiness and stuff like that, and I do notice that the tightening level with that laser. So what's different about the Fraxel than say with the IPL?
Fraxel.
Yeah, it's very fancy. Yeah.
So this is where my geek comes out.
Bring it out.
Yeah.
Whip it out.
okay.
But don't though.
Okay.
In the professional
Yep,
way.
professional
Yeah.
podcasting.
Professional.
Yeah.
We're all
So-
doctors here. It's
Yeah.
fine.
Yeah. So lasers, they all do things slightly differently, and they all target different things within the skin. So I talked about IPL targeting pigment in the skin. Fraxel works by basically targeting damaged tissue and replacing it with new tissue.
Okay.
And so its effects are even kind of a little broader than IPL because it can work for skin texture as well, and it can also work like it's a laser we use for pre-cancer, and it can actually be used for cancerous lesions of the skin as well. So its effect on the skin is not just cosmetic. But there's definitely a big therapeutic effect with Fraxel.
So
Yeah.
you got that on your neck
I've had it on my face and my
and your
neck.
deco de mode?
My décolleté. My décolleté. What is it?
Décolleté.
Thank you. Thanks. I'm winning. Yeah. So yeah, it was like honestly that treatment, just the way that the texture of the skin afterwards, and just not just the smoothness, but just the clarity of the skin is incredible. So I would highly
me in for
recommend that. Like that, you know what I mean? I think, I don't know, is that one of, sort of those treatments that you're like, if you were going to recommend one thing that was like the best, I want to call it bang for your buck, which probably isn't good, lingo to use, but
Bang
if
for
you
your buck?
Bang for your buck. If you were
Dr.
going
Bank for your buck?
Oh, Dr. Banks for your buck.
I'm so funny.
If you were going to really,
hashtag,
it's
I like
really,
it.
right? It's not bad. Yeah.
Make sure to hashtag don't mind if we do as well.
Yeah,
if you
please do.
Can we put that
Yeah.
in a bumper sticker?
Right. I don't know. I don't see why not. Yeah.
Okay.
But would that be one of those treatments?
Absolutely. I think that Fraxel, because of what it does and all it does, would be excellent value for people. And the good thing with Fraxel as well, because it's creating that new tissue, it's also all new collagen. So it's kind of turning back the hands of time. But it won't stop the progression of aging, but you'll always have that benefit kind of going forward.
Yeah, I like that.
So I think once when I saw you, I'm going to do it right now. I picked up the back of my neck and pulled it, and I said I want it to look like this, not like this,
Oh.
like this.
Oh, I see what you've done there.
Do you see
Yeah,
that?
yeah.
Like
I
a
don't know.
mum
Now
cat,
I want to try it.
A mum cat picking up
I
their
don't
cat
know
by
if
the
it's- yeah.
scruff. It's like
I don't have
"Oh,
as much scruff."
It's gone.
It's okay.
So would that be the Fraxel laser? Would that do that?
So
Or is that surgery?
Yeah. So that
Great question.
What you just did.
It's a neck lift.
Looks kind of odd because you don't.
Yeah.
Well,
I think it looks good,
Your
but-
neck actually looks great as it
I
is.
think you just keep saying that, but
Again, you're different doctors, so that's
yeah.
you have different opinions. That's
we
okay.
studied elsewhere, but it's fine.
But when patients come in and they do that where they kind of pull back as hard as they can on their ponytail or the back of their neck, my inner voice usually says they might be a better surgical candidate.
Okay, and that is something. So you
yeah,
can
because that is full on like cut skin out of my neck.
skin.
and bone.
Yeah. Like
Yeah.
you can look at that and say, like this makes sense. And I do think that all of the enhancements that you're able to do probably for many people would lessen the need for having surgery, right? Like that's kind of part of the plan in terms of preventative.
Absolutely. It's amazing what we can do non-surgically these days. If somebody, again, wants to kind of look like themselves, but, maybe a bit more youthful version of themselves and turn back the hands of time, we can do a lot of that non-surgically. But if somebody wants maximal, say, skin tightening,
Right.
especially lower face and neck,
Okay.
that's where,
Stop looking at me.
we'll at least talk to them about surgical options.
Okay.
Because those will give more dramatic results with one treatment.
I just want to look like Cher. Like, is that too much to ask?
You can turn back
You can
time.
turn back time. You've said it 3 times now. Turn back the hands of time.
Oh my
good
gosh.
one. Good
Right?
one.
See? Yeah.
Good. Whew. Going back though, when the first laser thing you said, IPS,
Yes, the IPL.
IPL, for the melasma and the sunspots. Also, even a lesser version of that. One of the girls at your place sold me the brightening cream.
Oh, yeah. This
And
is
then
good.
the retinol cream. And then, so I had the retinol first just by itself. And retinol does tend to dry out your skin if you don't do it properly, because there's like rules for it. And I never wash it off, and it's just bad. But that's a different story.
I think it's just called bad skincare. Okay.
Yes, bad skincare regime for sure. Yes, but that's fine. That's why my neck looks like this. Anyways, when she sold me the brightening cream, because I have one sunspot, which I never go in the sun, so it was weird. It's like my freckles are moving together as I get older. So there's one.
And they do that.
Do they? Ugh.
Really? They migrate together?
They do. They're little assholes that just go like this to make a big giant one. But I have one, which is fine. But then the summer, I had this one strip where I didn't put sunscreen on the top of my forehead. It rubbed off with a baseball cap. And I was in the sun for a couple hours having some drinks, of course.
Right,
Always the
as you always are.
drinks.
Yeah.
Drinks get me sunburnt. And it burnt on that little strip of forehead. And then I got this weird melasma, like a million freckles in this one tiny strip on my forehead. It was hideous.
Is that what melasma is? Sorry, I don't
Ridiculous.
even know. I'm going to consult both of you as my doctors.
Well, we'll take his opinion
Okay,
first, and then I'll
Dr.
give you
Ken Banks.
mine.
Dr. Ken Banks, is that what that is?
I'll give you my
Your professional
my
opinion?
professional
And then we
opinion,
can
and
get
then we'll get the
Chelsea's.
real one
Yeah,
with
okay.
Chelsea.
As I wipe my nose with my mask.
Also very professional. Yeah.
Yeah,
So to my knowledge,
we'll compare. Yeah.
melasma is it's a problem with pigment of the skin, and it is related to sun exposure, but it's also driven by hormones. So when it occurs in pregnancy, they call it cholasma, or also they call it the mask of pregnancy.
Okay.
And so it's basically hormonally driven melanocytes producing more pigment in the skin, and so it's usually a combination of that with made worse by sun exposure.
That's totally what I was going to say also.
I thought so.
But also I'm going to add in as well, you might have missed this at your med school.
Sorry, sorry, I must have.
Just kidding. I had just started birth control also, like a couple months before that, and so hormones, and it was just weird, and then it just was this weird thing. So anyways, they sold me the brightening cream. It's the white tube with blue. I'm not sure the brand.
Yeah, that's
Can't sell
Zeo.
it properly if I don't know, I
Yeah,
guess.
yeah. Zeo
Zeo.
is the brand.
And then she said, well, mix it with the retinol together, and then it goes farther, and it's totally gone. And
I was gonna say, I would never have known.
One asshole freckle that's migrated to a sunspot has lessened as well from that stuff. It's amazing.
So what you experienced is what I would say a medical grade, clinically proven skincare can do. And it's what a lot of people don't realize with skincare is, like, most people who go, say, to a drugstore and they pick up, the hyped up skincare at a drugstore, and then they get disappointed because it doesn't really do anything.
And it was expensive.
And it's expensive. It works like maybe a good, nice feeling moisturizer, but it doesn't do much beyond that. Whereas, some of the medically proven skincare lines like SkinMedica and Zeo, like you mentioned, those are designed to actually have ingredients that work.
Okay. So you've brought us some here today. You brought us some
So
good
exciting.
SkinMedica stuff, which is, again, top of the line medical grade skincare. The retinol, which we've been talking about already, right? So this goes on at night. That's correct?
Yeah, retinol goes on only at night, and a couple things. It's always good to go see an expert when you're talking about
Like
skin.
Dr. Kent Banks?
Or Chelsea Smith, like either
Okay.
one.
Yeah, either one.
I'm going to stick with Dr. Ken Banks.
You chose to be a coach on another episode. You
That's
decided
true,
it,
Ed.
so I'm
That's
choosing
true.
to be a
Okay.
doctor today.
Okay, that's fair.
so-
That's fair.
Okay, thanks.
I'm
Carry
still
on.
going to see Ken Banks.
Carry on. That's fine. It's fine.
Yeah. So I would recommend seeing somebody who is at
It's
least
not Chelsea Smith.
Fine.
well.
Come see me after for the photos.
I know
That's fine.
Chelsea
Yes.
is
Right?
great at
Yeah.
many things.
Yes, I am. Thank you.
Maybe not my number one choice for skincare, but
Just don't ever wash your face, and you'll be good.
Perfect. Yeah.
but if you go see a kind of a person that's an expert in dealing with skincare, I think I think that's really important.
So just one
because
of three of us,
Yeah.
basically, is what I'm hearing. Yeah, okay,
Yeah.
that's fine.
Whichever one.
one of four, because there's
One of
the
four. Madeline, and
It's
her
Madeline
skin's
here.
little
Yeah.
beautiful.
pooch under
That's
the
true.
desk there.
14. Look how good she looks. Like,
Wow.
It runs
She
in my
does.
family.
Yeah.
So.
Yeah.
Right?
Yeah.
She's
Yeah.
also been to MD Aesthetics.
She has, yeah. Doggy
yeah. Her
care.
Botox is wearing out.
It is wearing out a bit, yeah. But don't tell her.
I won't.
Okay, so retinol at night.
Yeah, retinol at night.
Okay.
Retinol. Just one thing I'll mention is it's very effective. Like some skincare, there will be a bit of a transition phase when you first start it. So it's important to talk to an expert about how to kind of use it appropriately and kind of get through that. Because once you're through it, your skin gets kind of
Significantly. And that's what you were
Adjusted.
talking about, like the drying and stuff like
It's
that. which
harsh if
Chelsea
you
was talking
don't follow instructions.
Yes. Yeah. Definitely follow the instructions. That's key. The
As
other
my skin is flaking off right,
right.
now.
I wasn't
'cause
going to say
don't
anything,
follow
but I was going to pass you a
instructions.
napkin. Okay, that's fine. The other thing that's super important and that you're always on me about, Dr. Kent Banks, but you have to because otherwise I won't do it, is sunscreen, right? Like
Yeah.
that's what we have here.
Yes.
Number one. So
Yeah,
that,
number
sunscreen is the most important thing for anti-aging and for skin health. Bar
And
none.
always, right? Not just if you're going out into the sun.
And
like every day.
always be consistent with it. Apply it once in the morning. If it's if you're going to be outside, if it's the summer, you have to reapply it basically every 2 hours. If you go, in the pool, if you go, in a lake, you have to reapply it when you get out. So but really, most people don't apply sunscreen every day in the morning. I would say get into that routine.
Can we call a friend? I'd like to call my mother on this podcast and just have the expert. Either one of us could talk to her.
Your
but-
mom would tell you a few other things too.
She would,
like
but-
my mom.
Yeah.
She tells me to drink lots of water,
Right.
to eat my fruit and veggies, and all of that. It's kind of really and
That's
don't
good,
smoke.
too.
Don't
No,
smoke.
Don't smoke. Smoking's bad.
Don't go to
Very bad
tanning
for
beds.
your skin. Yeah. Well, my
So
mom
mom's-
loves tanning beds
Uh-oh.
and loves the sun, so that wouldn't be her advice.
Okay.
But I bought her some nice cream for Christmas with a sunscreen in it, and if she's listening, like this isn't to be rude or anything, but she's like, "Oh, okay, like thanks. I'll use it in the summer when the sun comes out." I'm like, "No, like it's for
All the
every
time.
day, every day."
Mm-hmm.
And she just it has sunscreen in it, so no, like she just didn't get it or something that
I feel like
you
our
can wear it
parents,
every day.
and I mean, even we came from a generation though where, when we were younger, we would tan with oil on our bodies, like
Tan
you'd-
better with it.
right? Yeah, like
Yeah.
you just throw some
Yeah.
oil on or whatever, and then that was what you
Yeah.
did. And so I feel like that's only in this next sort of generation that's up and coming now are we seeing people really sort of start to take care of their skin from a younger age. I don't know, but I won't be the professional on that. You know who will be? Dr. Kent Banks.
Oh,
For me.
yeah. But and you can see why in certain generations or certain people that they kind of have that feeling. If your skin's not getting burned, you're not doing damage.
Yeah,
But
like sunscreens for the sun is basically what it
but,
sounds like it would be, but it's not.
But it's not because the UVB we'll call B for burn.
Is that what that actually stands for?
No.
Oh.
That's
That'd be so easy
that's
if it
that's a good way to just kind of remember it. UVB
UV
for
burn.
burn, UVA for aging.
Got it.
I was going to say asshole, but
Once again, that's
not
the
what
only
it
word
is,
she knows that starts with an A.
apparently.
Yeah.
So what's important is that to know is that the UVB rays, which are the ones that cause the sunburn, those are blocked. A lot of those are blocked by clouds. A lot of those are also blocked by windshields and windows, but they don't block UVA. So a lot of UVA still gets through that. And UVA is actually really important, and probably even more important than UVB for aging, and also for kind of producing skin cancer and skin cancer risk. So even though our skin doesn't feel like it's burning, it doesn't really matter. You know, even if it's a cloudy day or we're driving and, you know, we're right
coming
next
through
to
the window.
it's coming
Right.
through the window, that's not protecting us. Whereas a really good sunscreen, and I would say that it should be a broad spectrum sunscreen, that will protect you. Another thing to know is that, you know, the SPF factor, that's just basically based on UVB,
The burn. Yeah.
the burn factor,
Yeah, not
right?
the- not the A.
UVA. So, so you really should look for a sunscreen that is broad spectrum. And most of the so-called mineral sunscreens are broad spectrum.
Nice.
Yeah.
So I just want to go back to he just confirmed my medical advice. So I'm just like we're on the same page,
Right.
with our medical advice for sunscreen.
You're basically like
at
a
all
backup
times.
doctor. Like if I,
Are you hiring? Because I could take on a part-time position. They're only part-time because I have this podcast.
I don't think we could afford you, Chelsea.
that's a really good
That's
point.
true. That's
a
an
really good
excellent point.
We talked a little bit too about the importance of hydration and stuff like that, and this is a new product from Skin Medica. Well, fairly new at this point. That you brought to my attention last year, and I love it. This is probably my favorite product of the Skin Medica products.
Yeah.
That's all it does. It basically, it's like
Hydrates?
a drink for your skin.
Oh my word!
Is that,
I'm excited.
is that how
Yeah.
they describe it? Yeah.
Yeah, yeah. I mean, that's the way it feels too.
It's amazing.
Yeah. So the HA5 is what we call a hydrator, and HA stands for hyaluronic acid. You know, that HA molecule we all have in our tissues, but it tends to dwindle over time, and it's really important to have that because it kind of retains all the moisture in our skin. So it's different than a moisturizer. A moisturizer, basically, most of them just produce a film over the surface of the skin. The HA5 actually helps to retain the moisture in the skin.
Nice.
And this particular product doesn't just give you HA, it stimulates your own body's production of HA.
I'm so excited right now.
Yeah, it's really good.
Is this the same product as the brightening cream, just different brand? Because that has HA as well.
So
think.
that one has HQ.
Okay.
So, yeah.
Different.
Yeah, hydroquinone, which is, it is a different. So that's not a hydrating substance.
Just
that
brightening.
is for brightening. Yeah.
Perfect.
Yeah.
Can you mix the two?
Oh, great question.
Can you do all of this together? I'm going to have like
Absolutely.
the thickest layer of shit on my face after this.
Honestly,
But I
the
look young.
HA5, it feels so elegant on the skin.
Yeah.
You won't even know that you're layering on top
Love
of it.
elegance. I love it.
Yeah, this is your product.
It even
This
has
is-
a silver
right?
shiny box.
This is for you.
It
You know,
is.
guys actually really like HA5 for that reason too, because a lot of guys, they don't like that kind of thick moisturizer feeling. So the HA5 is perfect for guys.
Let's talk about men's skincare in
Let's
terms
talk about
of
men.
Yeah,
Let's-
right.
let's
we love
talk
that.
about men.
We love talking about men.
Yeah. Let's talk about men.
Do you know any that want
Any
to say
single
me?
ones that are interested in Robin?
Just like another doctor? I don't know. I could handle a
Yeah.
doctor. I feel. That's, yeah, it's fine.
I'll look in my colleagues and see
Okay.
who I know.
Great. Yeah. But what for men? Like, are there specific skincare things, or maybe things that men don't think about that you would offer?
Yeah.
Yes.
Like
Aesthetics.
tweezing eyebrows.
Right.
So that's what easy
Oh.
one that they could
Oh,
do.
is that, are you
Not
looking at me,
yes, no,
Chelsea?
I wasn't.
Sorry.
Even looking at my forehead the whole time, so I figured it was
Right,
even.
it's a trade-off.
Yeah.
Yep.
Yeah.
No, not
Yeah,
you,
fair
but
enough.
some don't even look in the mirror, really.
Yeah, that's true. It is changing a bit though, because you know we are seeing more and more men coming through our doors, and a lot of it is, you know, I still feel that men they come in for kind of, we'll say, functional reasons. Like they'll come in not because they inherently look in the mirror and they want to look better. I mean, some of them do, but it's quite often because they want to, you know, be more competitive with work.
Okay.
You know, they
Interesting.
yeah.
Like they want to look better.
They want to look better,
For the part?
but for a secondary reason.
Interesting.
Yeah. So they and they're also usually very results oriented. Like they like we all want instant gratification, but
But
you know,
men so more.
Lip filler.
Yeah.
Instant.
Instant
Yeah.
gratification. Yeah.
Instant.
Yes.
Botox, not so instant.
yeah,
Yeah.
yeah.
That's interesting. So what usually when men are coming, what kind of things are they coming for, do you find?
So really popular treatments. I mean, a lot of men come in for Botox and filler.
Okay.
So for men, as an example, really common to treat their frown lines.
Right, yeah.
Kind of because a lot of men, you know, when they're focusing, they'll tend to, you know, frown a lot, producing that line. And for a lot of people, for a lot of men, they get feedback that, oh, are you angry? Or are you frustrated with me? And then they want to have that treated. So that's a really
Called
common
resting
area.
bitch face, I think.
Yeah.
Yes. So
I'm
you're
not sure
treating
what the male equivalent of that is, but
resting bitch face, I think.
I think you're
It
right.
could be for both
I
sides.
think you're right.
Absolutely. Yeah.
So that's really common. Filler for the under eye, like the tear trough area, because you know that we all lose support in that area, so we get shadowed in the under eye area.
I'm up next for that. It's on my list.
So that's really common with
Yeah.
men too.
And this one too, the temples, or no?
Yeah, temples. Yeah, definitely. Women, it's still more because women tend to lose a bit more structure through the temple area. One thing that we're doing a lot of now is PRP for hair loss.
That's interesting. Tell us about that. Like, how does that work? It's basically like PRP, from what I understand, is like you take the blood, right, and you spin it and you get the certain cells out of it, and then you re-inject that back, and it helps with regrowth. Is that like,
Yeah.
again, not
Yeah.
being a doctor, except maybe I am surprised.
Right. You
Right?
can't take
Yeah.
my spot.
Right?
No, it's mine. It's my spot.
We'll see.
Doctor spot is mine.
Yeah.
You can have coach.
Okay.
It's yours. Yeah.
Yeah, so exactly. So what we do with PRP is we kind of take a little bit of the person's own blood and we separate their own growth factors out. So it's kind of proteins that we all have in our blood that stimulate new cell growth and new kind of collagen growth and new tissue growth. And specifically when we do that for areas that are thinning or balding areas, we usually see some nice regrowth of the hair. And also it is good for helping to prevent further loss.
That's pretty incredible. That's a pretty neat, and it's cutting edge. Like I only know of it because it was a treatment that I had to treat tendinitis in my elbow, and they do the same thing. So they pull the platelets and then they re-inject it. And honestly, for areas like you said that don't get a lot of that stimulation, incredible. It's the only thing that fixed it. Like
Yeah.
So it definitely it's really cool. I think that's really neat.
Does it work for breast implants?
Okay.
To for augmentation.
Stimulate growth. No, to stimulate growth.
So
that has
instead of a
stopped.
breast
Yeah.
implant,
Yeah. Can you inject it and it will grow?
short answer is no. Unfortunately,
I'll get a second opinion.
One thing I'll mention is it does we've seen really good results with it. If somebody has an area that they've been bald for say more than 5 or 7 years, it is less effective.
Okay.
Which is
new
I'm
thing.
really sad about that.
Right.
Must be like a
Newer. Yeah.
issue.
Yeah.
Newish.
So catch it fast. If you are balding, go see Dr. Banks now.
Good point, though. Yeah. Right.
Yeah.
So
Not waiting. Don't wait.
yeah. And then you will not that anyone doesn't look amazing, but
No.
it's always about looking and feeling your
It's how
best,
you
right?
feel,
It's
yeah.
how you feel in your own skin.
Yeah.
And so I think that's, we understand, different enhancements aren't for everyone, but they definitely are for us.
They are definitely for us. And if you didn't get that from this episode, we'll have to do a second one because we made it very clear we are not against it. And you guys have so many treatments that aren't needles and fillers as well. Like you do facials, anything that, like there's a lot of things that you can go to MD Aesthetics for that don't require needles.
Yeah,
as well.
most of our patients are really surprised, like when we start to talk about the different services that we offer on the breadth of what we do, and we've talked about some of it, but it's just kind of a fraction of really what we do at MD Aesthetics and what we can treat. Like cool sculpting, and that's another.
Yes.
Sounds
Yeah.
very
Which
cool.
is it's also amazing.
Yeah.
You've had that too?
I've had a little bit of it done, yeah. So it's pretty neat because like you can actually go in and it freezes the fat cells, right? And then your body just like bumps them out like a bad roommate.
So good.
Right. Yeah.
Or
Yeah.
a bad podcast host. Not that I've ever had one.
Right? I was
'cause
going to say,
haven't.
wait, are you referring to me or
No.
yourself? Okay, I don't
Myself.
know.
Yeah.
That's fine. But that's pretty cutting edge technology. And then again, it saves people from, there's no downtime with that, right? Which is very different from surgery.
Is it instant, or is that one that takes a bit of time?
Yeah, it does take a bit of time. So, like Robin said, what it does is it cools the cells very specifically to a temperature where the fat cells basically are triggered to be removed by the immune system, leaving the other cells of your body kind of free and clear. So it's very specific for fat. And it's really good for people who have a bulge or a contour that's always, kind of bothered them. And they just want to slim that down.
It's not a weight loss technique. We should probably
100%.
Say that, yeah.
So it's not made for people to lose weight. But if somebody does have a contour that's always bothered them, and it doesn't matter how much they diet or how much they exercise, that is a really good target for cool sculpting. And the good thing about cool sculpting is that once that contour is treated and we get that looking the way the person wants it to, those results will be there going forward.
Yeah.
So even if they gain weight, that contour will still be improved.
Yeah. It's pretty
So
amazing.
is somebody who likes fast food a good candidate or not a good candidate for this treatment?
Great question.
Yeah, it is a great question, and
It is, you idiot. That's a great one.
I
Didn't say it was me in this room. I'm just asking for a friend.
diet. I mean, it's almost. It doesn't really matter, like in terms of
Perfect.
diet.
So you can. Great. Got my
Because
answer.
it's gonna,
Done.
it's
Nailed
still,
it.
it's still going to work. I always tell people though, the more that you can do with diet
Of
and the more
course.
that you can do with exercise, the better your
better.
results you'll be.
Right. And it's expensive. So you don't
Yeah.
want to be paying that and then eating like crap.
E-
And it's kind of counteracting. what you're doing,
Exactly.
for sure.
It'd keep you on track.
I think I did ask this question in the office. I haven't tried the diet yet or the exercise yet. Can I just jump straight to the cool sculpting,
right?
with
Yeah.
my McDonald's? in
Chelsea
hand?
doesn't mess around.
I don't.
Okay,
Like,
she's all in or all out.
I'm
Okay,
busy.
that's-
I'm a
yeah.
busy person.
Right?
Yeah. So, but it's expensive, so I haven't done it yet.
She looks great.
Right?
She does.
She looks amazing. We all look amazing.
We all do.
And it's because of Dr. Kent Banks and the excellent staff at MD Aesthetics,
Yes,
Dr.
they
Dan
are
as
great.
well. Big shout out to him. So, lookamazing.ca if you want to find out any more about the treatments. You can also head over
Or just
to...
go to our Facebook profile pictures.
Right?
And
I was
look at
just going to
us,
say,
and
head
it's
over
like-
to Don't Mind If We
Yeah.
Do and check it out because that's probably, we're basically walking billboards. So
Well,
here we
not
are.
right now. Actually, he's like, don't.
That's true. I'm
Forehead's
wearing a hat. So okay, we'll fix that and then we'll take some new photos.
Okay, so go back to their website. We'll wait. We'll go back.
Lookamazing.ca it is.
One more question. What is your
Sure.
favorite treatment?
Great question.
That you do.
My favorite treatment that I do, I've got to say filler. Like it's gratifying for me, and it's also so gratifying for the patients.
Because it's so instant.
It's instant, and we can restore contours back, like I say, 5, 10, 15 years. So, and so it's got to, and part of me, I do have a bit of a artistic, we'll say, side, and
Of course you do.
yeah, it kind of really kind of fulfills me with that as well. Yeah,
Because you're enhancing people's beauty.
Yes.
yeah.
Yeah. I always like when the first day when I get the lip filler.
When your
'cause
lip-
they're
and it's-
massive.
And when you post it on social media, it's
Yeah,
interesting. Like
it's funny.
when you posted it
Yeah.
last time and it blew up.
It wasn't a picture about my lips. It
not
was
at
a
all.
different picture.
Yeah,
that I
and
was
everyone
posting.
was like, "Oh, your lips look amazing!" And there was like 300 comments on the
so
on
many
your lips,
comments
yeah.
on my
Yeah.
lips. Like this wasn't about my lips, but thanks and thanks for outing me. That I didn't on my own podcast, but still,
I
it
told
was a
everyone
little
too.
bit rude. Maybe they're mine. Maybe I was born with it. But it is the most fun, and I think even the second time I came back, I said I want them to look like the day you did them the first time because it goes down. stops swelling or whatever it is. It goes down a bit.
It does, and I
Yeah.
actually talk to patients about that. I say, the first day you'll probably think they're too swollen. The second day you're kind of thinking, okay, yeah, they look great. The third day you're going to wish that they were like
Back
that.
to the first, yeah. Yeah, like I'm almost wanting to go for more, but I won't. Botox first. But
Well, we'll see you next week, Dr. Kent.
Yeah.
Thanks.
Sounds
mind if
good.
we do.
Don't
I
mind if
look
we do.
forward to it.
thank you so much for coming to our show and letting everyone know what you do.
Thank you so much.
Thank you for
Thanks,
confirming all
guys.
my background and doctor degrees that I have. So it's been good. Yeah.
And just thanks for being so knowledgeable and so great. What I love about MD Aesthetics too is the people are so amazing, and it's yourself, Dr. Kent Banks, Dr. Dan as well, but also all of the staff, like all of the
they're
women
lovely.
that work there are fantastic, and I think everybody has the client's best interest at heart, and I think that's really important, especially when you're going in for some of these treatments that maybe you're feeling super comfortable about. Maybe if you're going for the first time, you're like, oh, I don't know what to expect. But the staff there always make you feel 100% comfortable, and they're so friendly and genuine when you walk in the door, and that's huge.
Yeah. Well, thanks,
they're
guys.
awesome.
I think we've got a really good team, and we're one big family. Is the way it feels like,
Yeah.
and we treat our patients like that too. So, yeah.
Yeah, we'll be over for dinner later.
Okay.
Thanks for the invite.
Okay.
Family,
If you
family
could bring
time.
some more of this.
I will. Some more Millionaires Row.
Yeah.
Oh, yeah, Millionaires Row. It's good. Hey.
Yeah, it is good.
Yeah,
Yeah.
it's not bad.
Yeah.
Cheers to being millionaires.
Yay! Someday.
Someday. Cheers to Botox then. Cheers to
Absolutely.
Botox.
Cheers to that.
Thank
Thanks,
you.
guys.
Don't mind if we do.
Don't mind if we do.
Don't Mind If We Do is brought to you by Vintage Chic Portrait, helping everyday women feel beautiful in their own skin.
Thanks for listening to Don't Mind If We Do. If you loved it, please share this episode with a friend and follow us and check us out on Facebook, and we'll follow you back. As long as you don't mind if we do.
You probably won't mind. You'll probably like it.